many states in the Midwest are seeing an increase in incidence and an increase in hospitalization. Those are the result of ongoing transmission in communities, and it's the same in Iowa. We multiple regions of Iowa are experiencing increases in cases due to large gatherings, weddings, and bars remaining open, not having a mask mandate. So we know how COVID gets transmitted, and as a society, as a state, we have not fully implemented all of the measures that can prevent its transmission. So it shouldn't surprise us that the incidence is going up.
You can just see in the graphs, on the state data, on the state website of, it was super high in May and June, and then it kind of went down, and then now it's going back up again. Do you think, again, that just schools are back, more people are moving around, maybe there's some fatigue? Any other insight of why those numbers are going up?
Yeah, it's all of the above, absolutely. The incidence is going up, so in the community, so meaning that if a few months ago you could perhaps go and have a small gathering and take some risk and be lucky and not get infected, when there are more cases, you cannot pull that off anymore. So that's one problem. When there are more cases, you're supposed to hunker down some more, but these increases in cases in Iowa and the Midwest are catching us more than 6 months into this pandemic.
Because it's going to get colder and people are going to go back inside, and you don't have that open air that kind of helps reduce the spread, and you also have the flu season, does that give you concern where our numbers are, that in the next month or so things are going to get even worse?
There is always that risk. We know what COVID can do to society, and the risk has not gone away. As people say, we have gotten tired of COVID, but COVID is not tired of us.
Yes, our hospitalization rates and our cases are going up, but we're in a much better position now than we were in April and May in terms of like PPE supply and knowledge of the virus and all that. Do you agree, or what's your take on that?
So it's probably fair to say that there's more PPE, that maybe we have more ventilators. I still don't want to use them, right? I still prefer not to depend on a machine to breathe, and that's for me, and it's for my family, and it's for my neighbors here in Iowa. So the fact that we have capacity to treat you when you are very sick doesn't mean that it's okay to get sick to begin with. But by the same token, we can, right, it applies to any disease. Yes, we can treat cancer, but I don't want anybody to get cancer if we can prevent it. It's the same with COVID. We know how to prevent it. Thinking that we have enough capacity to take care of patients with COVID is not enough consolation. It was probably okay very early on in the pandemic when we were kind of caught off guard. It was okay to just aim to have enough capacity to take care of people. But at this stage in the epidemic, with how much we know about how to control it, the aim cannot be only on having enough capacity to take care of sick people. The aim of public health should always be to prevent people from getting sick.